Good morning. Pretty exciting morning. Welcome to the Arkansas Children's Southwest Little Rock Community Clinic Care Close to Home groundbreaking ceremony. I'm Tom Baxter, chair of the Arkansas Children's Hospital Board, and we're delighted to see such a wonderful turnout, especially all the children that are here with us today. Thanks, kids, for being here. I want you to remember that everything we do at Children's Hospital puts the children first, and we never need to forget that. Before we begin, however, I'd like to recognize some very special guests here today. First, the Consul of Mexico, Rodolfo. Thank you for being here. And our speakers today, Little Rock Mayor Mark Stodola. Mayor, thank you for being here. Arkansas Children's Hospital CEO and President, Marcy Doder. Marcy, thanks for being here. And a really special person that had a lot to do with what's happening today and leading up to today. The ACH Community Pediatrics Medical Director. He's also a UAMS Associate Professor of Pediatrics, and he's the Section Chief of Community Pediatrics, Dr. Eddie Ochoa. And then another very special guest, our parent advocate, Suzanne Mancera. Thank you for being here, Suzanne. We'd like to thank our design and construction team, Polk Stanley Wilcox Architects, Nabholz Construction Services, Landscape Architecture, Inc., McClellan Consulting Engineers, Inc., Architectural Engineering Consultants, LLC, and Live Oak Engineering, Inc. Please join me in congratulating them. I'd also like to thank the Little Rock Regional Chamber of Commerce and President and CEO Jay Cheshire for their continued support of Arkansas Children's Hospital and for supporting us here today. Jay, thank you very much. Where's Jay? I didn't get to speak to him earlier. There he is in the back. Thank you, Jay. Arkansas Children's identified the need for a pediatric clinic in southwest Little Rock due to an increase in Spanish-speaking families traveling to our primary care clinics. The search for a location to house our first freestanding bilingual pediatric clinic was a long process. It extended over 18 months, but as you can see, it is well worth the wait. Thanks to the support of Mayor Stodola, the City of Little Rock Board of Directors, and all of you here today, this vision is becoming a reality. Located here at 9015 Daily Drive, the over 11,000 square foot clinic will stand behind us. We're nestled on 2 acres here, and we're going to try to preserve all the trees that we have here. Plus, you'll note the clinic sits behind the existing walking trail, which makes for a lovely walk, especially this time of year during the fall. It's really a wonderful location, and we're very fortunate to have it. Thanks again, Mayor, and thanks to the city again. We look forward to providing care close to home for the patients and families of Southwest Little Rock when the clinic opens, and that'll be in the spring of 2017, and I hope you'll all be back to celebrate with us then. And now please join me in welcoming the Honorable Mark Stodola, Mayor of the City of Little Rock.
Well, thank you very much, Tom. And good morning to all of you. What a great, beautiful day for this groundbreaking. As Tom mentioned, they spent 18 months to find this location, and it is such a natural fit for the partners of the City of Little Rock and Arkansas Children's Hospital. And so we're excited about that. Let me recognize City Director Joan Adcock, who has worked very, very hard in our community here in Southwest Little Rock, our Hispanic community. And also, I'm happy to recognize also Senator Joyce Elliott and Representative Fred Love, who represent this area. And thank you for being here. Their commitments to what this means to children, particularly in this part of our city, is so very, very important. And their leadership has been very, very helpful in bringing us all together as partners. And of course, while we're talking about a building, what we're really talking about are these kids over here. We're talking about the children of our city, the future leaders of our community. We're talking about the wonderful diversity that continues to grow in this wonderful urban environment of our city. and really enhancing the life of our kids, providing much needed quality health care to citizens that truly, truly need it. The key to every great vision in Little Rock is to see a great relationship, and I can't tell you how excited I am about this partnership. And that's really what government at its best does, is it creates partnership. And so the ability for us to partner with Children's Hospital, with the Consul General, and what that council represents to the city and to the community, particularly our Hispanic community here in Southwest Little Rock, is so critically important. We are thankful to have that kind of relationship, and of course we're leasing this to Children's Hospital for 99 years for $1. And I think that means that it's going to be here for a long time. And I can tell you that we are so proud of Children's Hospital and what it means. It is significant to not just this part of the city, but to the entire state, and as a matter of fact, nationally. We know that Children's Hospital is recognized nationally for all the great work that you do, and I can only believe that it just spells more and more opportunity for us to provide quality health care to much needed segments of our community. So as we witness this groundbreaking today here in Southwest Little Rock, it's, as Tom mentioned, it's a part of our city and a park. We've got a trail out here, and it leads to great partners with the city. We've got our police department, our Southwest Precinct Police Department, that you can see through the trees. We've got the library, the D. Brown Library, a wonderful, wonderful resource. We've got our Southwest Community Center, and of course, we've got our own Pulaski County Southwest Health Clinic. So that type of partnership, along with Children's, really spells a wonderful opportunity for the future here. And I want to thank you all for your dedication and your commitment to making the lives of our citizens, particularly our children, much, much better. Thank you.
Thank you so much, Mayor. We really appreciate you being here today and for everyone. Though I will say, I guess this will be the third time you hear it, it took us 18 months to find a location. We had great vision about what we wanted to do in Southwest Little Rock to serve this part of our community. I have to admit, we didn't have a great vision about where, and we struggled to find a location. And in February of this year, Representative Love and Senator Elliott came to us and said, we have an idea for you to explore. Eddie was in the room, I think. Rob Steele, our Chief Strategy Officer, was in the room. And we listened to the idea about what was happening out here, right off of Baseline Road, and that there was land available potentially to do something different. And that was tremendous vision. So thank you again so much for helping us see our way forward to be right here where we are today, and in a pretty fast period of time. I would also be remiss if I didn't thank the Board of Directors for Arkansas Children's Hospital. We've got several of them here today. It is their vision also that makes this possible. We're using board-designated strategic capital funds to build this project. It is over and above what we might normally do in capital investment for a year, and thank you to our board. There's Dorsey and Pat and Barbara and Tom, and I'm probably missing someone because there's a lot of faces out there, but thank you to the board for also supporting our vision to build a statewide network of care. You've already heard it. At Arkansas Children's, we do put children's first. That is what we are. It's in our name. It's our brand. It is who we are. And it's sad to say that actually in Arkansas, the health of children, though, isn't as important as perhaps what we think of as our brand. We have an immediate need to address the health needs of the kids across our state. According to the Casey Foundation, the NE Casey Foundation report, Kids Health Report that comes out every year, we rank 46th in the nation in child well-being. We believe we can move the needle on that metric. We believe that things like what we're doing here today can change the health of the kids in our state. For more than 100 years, we've had the opportunity, really the privilege of serving the critically ill and injured of kids across our state. We do that really, really well, and we intend to continue doing that. But we've also shifted our view. We've widened our view to ensure that we are addressing not just health care, but addressing health. How do we make and give every child in Arkansas a healthier tomorrow? There's a few things that I'd like to share with you of what we're doing beyond the clinic here, but none of it is more important. Every child deserves quick and easy access to care. A lot of children in Arkansas don't have that. My experience as a mother tells me that travel is inconvenient at best. It's impossible for many. And how can we then address that? How can we change that paradigm for kids in our state? So creating a statewide network is what we're about. We think that's the solution. But it's not easy. There's not an easy answer to every part of our state, to every community, or every county. So we're looking for innovative, creative ways to address the health of kids in our state. Today, we do it in Southwest Little Rock right here by breaking ground and using our friends over here in their yellow hard hats to do so. But we're also trying to get into the schools. Every child in our state goes to school. And so how do we address health in the schools and get care close to home where the child is every day? We're piloting telemedicine in school clinics right here in Little Rock, and we'll expand across the state to 42 other communities of less than 5,000 kids over the coming 3 years. And just a short little cool story, how convenient that kind of telemedicine is for a child in need. Rob Steele is one of our pediatricians who takes the calls from the school health clinic. He was traveling yesterday out of state, a learning opportunity for him. And a child in the Benton school his learning opportunity interrupted for being ill. But via the telemedicine, Rob stepped out of his conference, the child stepped out of his classroom into the clinic. We diagnosed the problem, got the kid taken care of, child went home with a plan of care, and hopefully we'll be back at school tomorrow. That was convenient for everyone, and we didn't interrupt anyone's learning. That's what I like. We're also working with legislators, with the leaders at DHS to figure out how do we go mobile? How do we take primary care in a clinic across our state to the most rural areas? It's not available to our state today. We want to make that happen, particularly in southeastern Arkansas, where a physical presence like this kind of clinic doesn't make sense, but we think mobile is the answer. And of course, you've probably heard our exciting news about building a hospital in Northwest Arkansas. 200,000 kids in an 11-county area. By planting our flag in a hospital that will open in January 2018, we will make a difference for care close to home for those 200,000 children. There are many other things we're doing, from expanding our research with diabetes and obesity research, expanding our presence with oral disease through our mobile dental clinics and our sealant program where we can touch over 5,000 kids a year, and by opening the new Clark Center for Safe and Healthy Children, where we can address the most vulnerable children in our community, those that are at risk for physical and sexual abuse or maltreatment. We believe we can do more. We know we will do more, but it will take all of us here to do it together. You see, we see children as possibilities. They're not just little individual little people standing over there. They each have tremendous potential and an overwhelming possibility to make a difference themselves. We believe our challenge and our goal is to help them achieve every one of those possibilities that they have. We may not be able to cure every child, but we can certainly provide a better tomorrow for everyone. So each of you who are here today have an opportunity to be part of that, be part of our mission to be a champion for children for the state of Arkansas. We on this team have an unyielding commitment. I am confident that everyone under this tent and the surrounding area also has an uncompromising commitment, an unyielding commitment to the care of children. That's how we will fulfill our promise to make them better today and healthier tomorrow. And with that, I'd like to welcome one of our best champions, and really a hero in my heart, to the stage, Dr. Eddie Ochoa. Again, he's part of this vision. He's part of our success.
Thank you, Marcy, and thank you, everybody, for being here. Today is about the children, but it's about community. It's about all of you. And we're really in, like we've said before, the perfect part of town. We're by the library, the community center, really where it all happens. But I do want to recognize those of us who are part of the community that helped make this vision a reality and who are here with us today. Quiero agradecer mucho a las familias que vinieron con nosotros hoy, la familia Ochoa, Ibran, y Camacho, y Cortés, y Reta, que estuvieron con nosotros. Quiero agradecer al cónsul para estar aquí con nosotros también. Muchísimas gracias. And I also want you to know the names of the people on my team. There's Charles and Megan and Ron and Shelley and Paola and Allison and Maria and Brittany and Elizabeth and Yuritsi. It really takes everybody who's here. Everybody who has come out to support us today is what's going to make this clinic a success. We have a building for you that's going to have exam rooms and x-ray. We're going to have WIC inside. We have a great partnership that's developing because of Representative Love with the health department. But this is what today is all about. So I thank you for coming today, and I'm proud to introduce one of our parent partners who was with us all along the way, Suzanne Mancera.
Well, good morning, everybody. I actually should say great morning because today is a great day. And thank you, Dr. Ochoa, for all of your hard work. And I actually would like to start with Dr. Ochoa because Dr. Ochoa has done an amazing work for our community. Most of the Latino families choose him as a pediatrician, not just because he is bilingual, but because he actually is a great human being. He's caring and he's compassionate. Children's Hospital has been a part of my family for so long. Both of my children, Oliver and Annabella, were born with jaundice and spent their first 2 days at Arkansas Children's Hospital. We love them for life. A few years later, my son Oliver was first diagnosed with autism at Children's Hospital. And we also choose a dentist for him at ACH because of their incredible experience with special needs children. Not only do I have the privilege of being a mom of these two wonderful children, but I'm also a parent advocate for the Autism Treatment Network and a volunteer at the ACH West Little Rock Clinic, helping Spanish-only speaking patient families understand their child's health and new diagnosis, providing resources and support. As a mom with a special needs child and as a Latina, I understand how a parent can become overwhelmed with medical terms and acronyms. It is like a different language, and if you speak only one language, it becomes even more challenging. We needed help from those who could better serve the community and offer care from the Arkansas pediatric experts. And now, the Arkansas Children's Southwest Little Rock Community Clinic is going to be a dream come true. It will change the history of Little Rock for being the first pediatric clinic with bilingual services, providing care close to home with families here in the Southwest Little Rock area. To Arkansas Children's Hospital, to Dr. Ochoa, and to the city of Little Rock, I speak for my community and myself from the bottom of our hearts. We thank you. Gracias.
Uno, dos, tres, now. Right. One more time. There you go. And we don't have to get it all out, okay?